back, or welcome for the first time to the monthly meeting of the Kansas COVID Vaccine Equity Task Force. This meeting is being recorded and live streamed on the KDHA YouTube channel. So it's really nice to see everybody, and welcome to anybody who's here for the first time. My name is Jimena Garcia, and I am the governor's senior advisor for vaccine equity, and I'm going to be leading this discussion today together with Dr. Kali Akers and her team at KU, and also my colleagues at KDHE. If we could have the agenda up, I'm going to run through that. I'm very excited about today's meeting, especially our featured guest speaker. Is it possible to advance the slides? Oh, there we go. Perfect. Okay. So we're going to start with introductions. Then we're going to have Jamie Gable, senior epidemiologist at KDHE, who's going to review the most current COVID-19 vaccine data. And then I'm going to share some information about the newly approved COVID vaccine that was just released, and talk about some additional information about the Bridge program, which is meant to provide free vaccine to people without insurance. And then as a follow-up to last month's meeting when we did the breakout groups and talked about sort of messaging for the Bridge program, Courtney's going to give us a little update on a meeting, just our progress on a vaccine toolkit that's tailored for Black African-American Kansans. And then we're going to move to our featured speaker, Nicole Garner, who's the executive director of the Center for African American Health. She's graciously agreed to join us and share information about the center. So let's jump in. If you are attending this meeting for the first time and wouldn't mind, would you take a moment to just come off of mute and introduce yourself? You could just tell us who you are and a few words about what you're passionate about. And if you're a returning member, please put your name and organization into the chat. So do we have anybody new?
Yeah, I don't think I've been on before, Dr. Garcia.
Welcome.
Yeah, my name is Stacy Tobin. I'm the Community Health Program Manager at Heart to Heart International. So thank you for having me.
Thank you for joining us.
I'm Dr. Donis McFall. I am here. I am new, and I am here on behalf of the center.
Wonderful. Thank you.
Great to see you.
Thank you.
Hi, I'm Deanne White. I'm with the Genesis Foundation for Fitness and Tennis, and I'm new. We give out beds to children in the community, and so I plan to use this as an avenue to reach more children that might not hear about it.
Dan, this is the first time I'm seeing your face. Thank you for attending. Great to see you.
Thank you.
Good afternoon, everyone. My name is Richard, and I am with Bridging the Gap Interpreting, and we are a local language services agency that provides interpreting and translation services to the community.
Thanks for joining us.
Hi, I'm Shelley Duncan. I'm Executive Director of Project Access, which is a nonprofit program in Wichita affiliated with the Medical Society of Sedgwick County, and we facilitate donated specialty medical care for people with low income who have a serious medical condition, and all of our providers donate all of the care and treatment.
Thank you for being here.
Hey everyone, my name is Leonor Ramos. I am with Immunize Kansas Coalition, and I am a community health specialist with the organization. Thank you for having me.
Thanks for joining. Okay, wonderful. Well, welcome to everyone. It's nice to have a lot of new faces. Maybe we can put the slides back up. Okay, and I'm going to pass the floor to Jamie Gable, who's going to share the most recent vaccine data from the state of Kansas. Jamie, over to you.
All right, thank you so much. Thanks for having me, Dr. Garcia. So this will be our last month where we're focusing on bivalent booster dose uptake. When we meet in October, we will be shifting the focus to the new vaccine that Dr. Garcia will be talking about next. This was updated for the 2023-2024 season and was recently approved for use. We expect the numbers next month when we look at them to be fairly small, but we'll see what we have going on and present that to this group. So our first slide is overview of vaccine uptake in Kansas as of September 6th for 1-dose completed COVID-19 series and bivalent booster doses. We continue to see very small increases for 1-dose and completed series. For most of the metrics, the 1-dose and completed series only increase about 0.1% points. The largest increase from last month on this page is the 65 plus bivalent, which is increased by almost 1% point. And for the first time, we are seeing tender age bivalent at 2% coverage. So that is still not very high, but encouraging that people are getting it. Next slide, please. This slide, we have the bivalent booster uptake across different races and age groups. Native data is updated here to reflect anyone who has indicated Native as one of their races, and it has the highest coverage for all the age groups. White has second highest coverage for adults and older adults, and Asian has the second highest coverage for children. The biggest increases we're seeing in coverage from on this slide from last month to this month are the Native for all age groups. Lowest coverage for all age groups is the Hawaiian and Pacific Islander Kansans. Black Kansans have the second lowest coverage for all age groups except for the older adults, where Asian Kansans have the second lowest coverage for the older adults. I also wanted to provide a quick refresh on what any age AIAN means on this slide. So it indicates that Native was indicated as a race in Kansas Web IZ, but other races may have also been indicated. So essentially it adds those that are multiracial with Native as one of their races to those who have Native marked as their only race to provide a better idea of coverage. The other races on this slide, we do not include the multiracial individuals. The decision was made to include multiracial with Native marked as one of their races into this coverage based on insights and conversations from this meeting, actually. So it's really good to be able to use these discussions to provide more accurate data for our partners. As we move to the ethnicity slide, I want to remind everyone that when we calculate race, it's independent of ethnicity. So we have them on different slides to help make that distinction. And when I say they are independent of each other, that means if somebody is Black and Latino, they would be included on the rates for both Black and for Hispanic and Latino. If somebody had indicated that they were Black, Native, and Hispanic and Latino, they would be in the rates for any race, AIAN, and in the rates for Hispanic and Latino. So this slide is organized pretty similar to the previous slide, but now we're looking at ethnicity. We can remember from previous meetings that we typically saw higher coverage in the Hispanic and Latino Kansans for having received at least 1 dose of COVID-19 vaccine. So we continue to not see that trend when it comes to the bivalent booster doses. The increases for Hispanic and Latino coverage from last month were about 0.1% points for adults, 0.2% for older adults, and 0.3% points for children. Non-Hispanic and Latino coverage increases compared to last month were 0.1% points for adults and 0.2% points for the older adults and children. So in the children, we're seeing a greater increase in the Latino Hispanic coverage. That's the slides that I have for today. Thank you so much for having me. As always, please feel free to reach out for questions.
Thank you, Jamie, for going through that. Very helpful. And I am excited to see how it changes, as we get the new booster and see people's appetite for getting vaccinated. So let's see. I want to talk for a minute about the new COVID vaccine. So if you go to the next slide. So last week, the new COVID-19 booster was approved. It's recommended to everybody starting at age 6 months to infinity. So the only exception is if you've had a COVID vaccine in the last 2 months, then you should wait till 2 months pass to get it. But I think they're trying to make it easy this time around. So it's one kind of vaccine. probably it's going to be something we get every year. And it's already available in pharmacies and clinics. The rollout is a little slow in certain places, but it should be the only vaccine that's out there to get. And they've reactivated vaccines.gov as a way to locate the vaccines. And I've tried it sort of as a secret shopper, and it seems like new vaccine, you can find it, you can make an appointment, you can find out where there's walk-in. So we're kind of up and running, and we're just waiting to see how it goes. Let's see, next slide. So are people going to have to pay for vaccine now that we're going through a commercial process? And the short answer is no. Nobody in Kansas should have to pay for a vaccine. So if you have commercial insurance, if you have Medicaid, if you have Medicare, the cost of the vaccine is covered by insurance. If you're an adult and you don't have insurance, you should be able to receive the vaccine at no cost through the federal COVID-19 Vaccine Bridge program. So clinics and pharmacies that are participating in the Bridge program can be located on the same website, vaccines.gov, and you'll see pharmacies that are marked Bridge participating, and then you would know that that is a place you can get free vaccine. In terms of children who are not insured, any child that's not insured should be able to get a free vaccine in Kansas at no cost, a free vaccine through the Vaccines for Children program. So hopefully everybody that wants a vaccine should be able to get one, and cost shouldn't be a factor. Next slide, please. So how can those of us working in the vaccine world get the message across this time about COVID vaccines so people might actually want to get vaccinated? Well, that's $1 million question, and I don't have the answer, but there are some tools out there to help. And also there are some public sentiment surveys that have been done, are being done, have been summarized. So I'm going to present just a tiny bit of what I've seen. Sorry, I was just going to say, the first thing is, what we've been hearing is we shouldn't really lead with COVID vaccine or even talk about it all by itself. So people are calling it pan-respiratory immunizations, which I wish they would have a catchier name, but that's sort of what people are saying. So pan means all. So like all respiratory virus immunizations for the whole season. So it includes RSV, influenza, and COVID-19. So that's sort of like messaging wrapped in all three. Okay, next slide now. Just some other like kind of key points, and I'm going to be sharing the slides with the links to where these resources are available. But it turns out from surveys, 56% of adults probably or definitely are planning to get the flu shot, 42% the COVID shot, and 39% RSV. And it looks like intentions to get vaccinated increase with age, income, and insurance for both the flu and COVID vaccine. Next slide, please. Just a couple more things. Avoid directives. People don't want to be told what to do, and people prefer softer language, and no scare tactics. And then finally, educational materials help people think about getting vaccinated. But in the end, healthcare providers are once again sort of the people that can have the most impact on whether a person decides to get vaccinated or not. Next slide, please. So the CDC has some resources available for the Bridge program. This is a communication toolkit that was prepared by the CDC, and it has downloadable materials in English and Spanish. And I'm going to share the link. Next slide. There's also this FAQ sheet that's also available from CDC. Next slide. And here are the links, and I'll share the slide deck out after this is done. So I want to just pause there. I didn't spend a ton of time talking about details, but I'm happy to take questions if people have them and try to answer them. Okay, great. No questions. I am gonna then pass the floor to Vicky to introduce our guest speaker.
Oh, was Courtney going to review some?
Oh yeah, thank you.
Sorry.
I apologize.
Thank you, Vicky.
Yeah.
Well, I'll use this as a bridge that in the bridge program work group for the Black and African American Kansans, Dr. Jimena did not let me introduce it now. Okay, so there are a couple people from our work group who are on the call right now. So when I'm finished, I just want to pause for a second in case there's anything that work group would like to add. But we did have our first meeting on Monday, 10/18. There were 8 attendees, and we discussed how to make messaging better regarding the bridge program to Black and African Americans Kansans, how to reach non-English speaking communities, how to make our reach as large as possible. So just to blanket, I think the word that was used was flood. So to flood Kansas with all of the information that's necessary, and what content is actually wanted by the community. Our next meeting will take place within the first 2 weeks of October to determine actionable steps and to promote understanding and utilization of the bridge program. So just a brief pause. Anyone who's in the work group want to add anything to that? I'm also loving the chat. I'm glad that this is an exciting place that people want to be.
And just to add to that, in addition to that work group, El Centro and Immunized Kansas Coalition have a partnership to create a toolkit for Latinos in Kansas, and they are going to join us next month and just share some of the things they've come up with. Okay, I guess now I'm going to pass it to Vicky to introduce our guest speaker. And thank you, Courtney.
Thank you, Dr. Garcia. We are really excited to have an opportunity to hear from Nicole Garner. Nicole is, I think, the inaugural director of the Center for African American Health at the University of Kansas Medical Center. Nicole has a lengthy background in healthcare, working in long-term care settings and a lot of healthcare leadership. In addition, her work, particularly around COVID in Wyandotte County, has really made her an influential figure in public health in Kansas. We are really excited not only for Nicole's leadership with the center, but also to have her here to tell us a little bit more about their work today. So thank you, Nicole, for joining us, and we're excited to hear from you.
Thank you so much. And excuse me, I'm trying to get a little cold, but I am fighting it off as best I can. But I'm so happy to be here this afternoon, and thank you for that lovely introduction. Again, my name is Nicole Garner, and I am the Executive Director for the Center for African American Health. And before I begin, can everyone see my screen? Okay, perfect. All right. Well, I want to first start off by introducing our small but mighty team, and I'll kind of get into the discussion a little later about our 4 pillars, but I wanted to mention our pillar directors, which is Dr. Jill Pesler. She is over our service pillar. We have Dr. Jason Glenn, who is over our education pillar. We have Dr. Michelle Redmond, who is over research, and she is out of our Wichita campus. And then we have Dr. Charlotte Smith, who is over our policy. And last but not least, Dr. Geraldine McGee, who is the Vice Chancellor of and Chief Officer for Diversity, Equity, and Inclusion. And she is leading the entire department as our office, as the center falls up under KUMC's Diversity, Equity, Inclusion Center. So that is our mighty team. And the question was asked of me, and I've been answering the question, why do we need a Center for African American Health? And I think you all know the outcomes for Black and African Americans in the country, but specifically in the state of Kansas. And so I wanted to share some data with you and really help hone in and answer the question as to why there is a need for a Center for African American Health. And when we look at Sedgwick, Wyandotte, and Johnson counties, and then Kansas as a whole, Black and African Americans have the poorest outcomes or health outcomes. And so there was lots of conversations with thought partners, community leaders, health advocates, and professionals in public health in what that looks like and how can we create and improve the overall health outcomes for Black and African Americans, specifically in Kansas. And just to make the case a little, further, when we looked at just the overall ranking, Wyandotte County was ranked as far for Black people, African Americans, with regards to health. We were ranked 102 out of 104 at one point, and then in Sedgwick County, 70 out of 79. And so we always say the proof is in the pudding and in the data. And so that is, why there was a need and why conversations started to happen about 2.5, 3 years ago at the height of the pandemic. And the center's mission is really to partner with community to enhance and improve the health and the wellness of Black and African Americans living in Kansas and beyond. And just to kind of back up on, the original conversations and the start of the center. So this happened about 2.5 years ago, as I mentioned, where there were, leaders in the community wanting to come together to figure out how we can combat the systemic racisms that exist not only in the infrastructures of organizations, but also declaring racism as a social determinant of health and what that really looks like. And so this was birthed from that and creating a Center for African American Health. And although the target will be Black and African Americans, that also includes, but is not limited to, descendants of enslaved persons, refugees, and immigrants. And I also mentioned that we plan and we'll work with all marginalized communities to lift them up. Our vision at the center is to be the leading transformational force for community empowerment and health equity. We hosted several listening sessions before creating and launching the center, which was officially launched in July of this year. But a lot of the recurring theme was it's about time. We want to create a center that's for us, by us, authentically us, and that uplifts and supports us. And so our vision really is to be that leading transformational force for community empowerment and being able to not only hear the needs of the community, but being able to pivot and be responsive as much as we can. And so where is the center going to be located? Well, we don't have a physical space yet, but we will be serving 2 counties, Wyandotte and Sedgwick County. And the reason for that is because in both counties, this is where KU Medical Center has its largest footprint and where we have the most African Americans living in both of those counties, and unfortunately the poorest outcomes. So the plan will be to partner with FQHCs, and so in Wyandotte County, we're going to be partnering with Vibrant Health to help provide clinical services, and in Sedgwick County, we'll be partnering with Health Core Clinic. And so we're going to be one center, 2 locations, and again, we feel like that's going to make the biggest impact, and that's where the needs are in Kansas. And from our listening sessions, as I mentioned, we had specific goals that came from those listening sessions. And so I wanted to just, briefly discuss what that means and what our goals moving forward in the work that we will do is first to honor and value community voices. That's really important. Again, we know that, historically community has felt like they've been left out of the conversations or they haven't been heard. So we want to continue to make sure that we honor and value community voices. We also want to be intentional and deliberate about building trust and holding ourselves accountable to communities that we serve. And so it's important for us to serve the communities that we have a footprint in. We also want to identify and address and eliminate structural barriers such as policy, environmental conditions, and the lived experiences of discriminations. And what I always want to say to this is we want to call a thing. We want to acknowledge it, but then we want to understand and learn and how we can grow from that past experiences of discrimination. And then lastly, it's important for us to promote educational exchange between community members and Kansas University Medical Center to address the ill health effects of inequities. And so how do we do that? How do we make the biggest impact? And the way that we find that we can make the biggest impact is through our 4 pillars. And so our 4 pillars will be service, education, research, and policy. And when we talk about the service, it really is partnering with, a Vibrant Health and HealthCore Clinic to provide clinical care management and coordination for Black and African Americans. And in our education pillar, it really is about community engagement and how we can create equitable best practices, not only for students and learners, but for community. And in our research pillar, it is all about creating resources for not only KU Medical Center learners, but also staff, and how we can help investigate, or how we can help investigators, to be interested in learning about research and embrace and bring the Black and African American community into the research conversations. As you all know, historically, not only has there been a lot of mistrust, there's been a lot of misunderstanding. And so we want to be able to bridge that, bridge that gap and help researchers understand the impact of research, but also explain to them the value of getting community buy-in and being in the very communities that you are trying to research. And then lastly, the policy pillar, which is all around advocacy and helping to identify research and evaluations and asking the right questions, making sure the right people are at the table when it comes to research. And that is going to also on a local as well as a state level. So those are our 4 pillars: service, education, research, and policy. Now I want to just talk about a few of the programs under each of the pillars. I won't go over each because of time, but I'd be happy to share the slide deck and any additional information that you have after the presentation. But within our service pillar, one of the main areas of focus will be on our repair project. And the repair project is really designed and all around our clinical intervention. And so creating a health equity index and scoring that and having that index and dashboard to not only teach learners, but also community, and to ensure that any person going through the health system or any medical system, that they are receiving the best care, that they're being believed, that they have everything from, implicit bias training to understanding the unique needs of our community and what that looks like. Also expanding on transportation services to reduce the social determinants of health. Again, to develop partnerships that will not only help with free transportation, but also urgent care needs, such as pharmacy and grocery store runs. So those are just a few of the programs within our service pillar that we plan to take on. Excuse me. Under our education pillar, one of the primary focuses will be on creating a curriculum and having a curriculum series. Again, I mentioned implicit bias training, but also that includes the repair project. And Dr. Jason Glenn has done, and I don't know if any of you had the opportunity to attend these in the past, but a 6-part educational series that was phenomenal. We'll continue with those series throughout the upcoming year. And again, teaching on unconscious bias and then cultural and structural humility. And I did mention this, but with the work that we're going to do, it really is all about intentionality and being humble and having a space of humility to make sure that we're meeting the needs, not only of our KU MC staff, but also of the community. And so that is the education component and what we plan to do moving forward. Under our research pillar, again, I mentioned the health equity index, and a lot of the pillars will have that bidirectional, function. And so, although it will fall up under policy or research, we will all be working closely together to ensure that the initiatives and programs that we bring forth will have a centered focus on the Center for African American Health. And then the repair and history project. Within the repair project, we held listening sessions and spoke to Black and African Americans about their experiences. And within those experiences, we are recording those. Those will be held in the National Archives, and it will be their stories to keep. We will not own those stories, but they will own those stories. And so we'll continue to get stories and hear and learn about the lived experiences of not only racism and what that looks like in their experiences, but how we can learn and grow from those stories. And lastly, under our pillar is our policy. And our policy really is about how we can advance and promote the study of health equity to reduce the social determinants the social determinants of health inequities, and also how we can make the biggest impact with regards to science and moving interventions and practices, and also world-setting initiatives that will improve the overall quality of health for Black and African Americans in Kansas and beyond. And I mentioned that this project for the center has been in the works for over 2 years. So I just kind of wanted to briefly share the timeline and what that looks like, and then where we're at today. And so starting back in the summer of 2021, that was the first phase where we assembled the Center for African American Health Implementation Team. And that team was brought together to help with listening sessions and help to determine and figure out what our area of focus is going to be and what the center ultimately would look like. That also included identifying our target counties, which we identified was Wyandotte County and Sedgwick County. In our phase 2, this was all about assessing, and this happened starting in the fall of 2021. And this is where we were recruiting participants to conduct the listening sessions, also identifying funding considerations and developing of the mission, vision, and the goals for the center. And then lastly, the conceptual overview, which we use to help explain what the centers are going to do and our executive summary and really our overall goals. In phase 3 of developing the center, this was all around planning and designing. This again happened or was taking place in the winter of 2021 up until the spring of last year. This is where we, developed our logic model. We developed a budget plan as well as, writing what our bylaws would look like. We really wanted to gain and focus on stakeholder buy-in. And then we formed a formalized community board of directors who will help facilitate the leadership and the recruitment for the center, and then our overall budget and what that looks like. And in our phase 4, that was where they recruited the executive leadership team, which also was including having conversations with who would be leading the pillar work, in addition to developing a business plan and then initiating fundraising for the center. And then our phases where we're currently at in phase 5, the implementation, and that is again identifying, or we identify our core leadership team, continuing to fundraise, performing progress reports, and how are we doing under each of the phases, and have we sort of dotted all of our I's and crossed our T's. And then lastly, the phase that we are currently in is the evaluating phase. So that's where really we're going out and communicating to community, to stakeholders about the Center for African American Health, and then also compiling and organizing and looking at the data, the quantitative data and the qualitative data, and making sure that that is represented in the work that we do. And then also continuing to have ongoing conversations with not only community, but with our implementation task force to make sure that we're on target. And one thing I want to just say is that when you're having a new center, I think we have well-defined goals, but being able to be flexible and responsive to community is extremely important to us. And so I've also been asked, what is the ask, or how can we help support the Center for African American Health? Well, one thing I would say from a financial perspective, we're still trying to build out our infrastructure. And so that's one way you can support, as well as, program support for our pillars. And as I mentioned, all the four pillars, we're still really working on building out that infrastructure and that programming. And so any suggestions or any areas of opportunity to partner, we definitely welcome that. And then lastly, just helping to promote the center. I know many of you have heard about it. Many of you have come to me and said, we're excited for you, but there's still, the entire state that we want to make aware that we are here. As I mentioned, we don't have a physical space yet, but the plan is for us to partner at some point with Vibrant Health to share space with them. It's in the works, but that is our vision and plan. And in Sedgwick County, looking at identifying space for physical building is on the horizons as well. And so now I want to stop and ask if there are any questions.
So I have a question. What, you said you're looking for partners. What are you looking for in partners?
Sure. Well, we would be, and when you say what are we looking for, I think it's about if our vision and mission align with what you're doing or what an organization is doing. And so we're looking at everything from volunteers to help. We're doing a lot of resource fairs, and we're really educating the community. And so people that want to help support those efforts, as well as grassroots organizations that are doing work that is similar. What we don't want to do is duplicate service. So many times we see people working in silos. So, that could be us helping to support another organization that is already doing great work in the community, and looking at that being a bi-directional relationship, if you will.
So if we want to partner or learn more about trying to figure out how to partner with you, who and how do we contact you?
That's a great question. So I will put my information in the chat. You would contact me. We also have our website, which is really long. And so I'll put that in the chat as well, so that you can go on and look. And then there's a form that you can fill out, and I'll make sure I get that up on the chat. Thank you for that question.
I have a question. First of all, thank you for sharing that. And oh my goodness, I'm blown away by the scope of the goals and the work. And I just, one thing, I wish Roger Crawford was here to see it, because I feel like he's the person that I heard talk about it for the first time, and then it all made so much sense. But my question is, I'm just curious, as you go out in the community and share about it, what kind of feedback are you getting? Because there's always this sort of conundrum of like still being part of the institution that is the cause of the mistrust on some level. And anyway,
Sure.
how are you finding?
That's a great question. And what I will say is that the initial response is, whoa, or surprised, and also, but in a good way, that they feel that, KU is taking on, the medical center is taking on this project. So a sense of, honestly, it's about time, and I'm excited. And what I'll say is that, we still have some work to do. And if not, having a center for African American health that sits up under the university, or the medical center, I'm sorry, is a step in the right direction. And so I think they recognize, or the institution recognizes, that some of the historical relationships, some of the systemic racism that exist within the organization, it's time, and it's well overdue for us to start moving in the right direction. So to answer your question, there has been, surprise, but also excitement about the center, in addition to, happy that we are moving in the right direction.
I see that Jonella had her hand up.
And I should have done my hair a little bit better before I got on camera. But anyway, that's not important. Nicole, I think your work that KU has done has been great. What we have had for over 20 years until the pandemic was the medical van coming out and doing health assessments, tracking the data of our health in Nicodemus, Kansas, and providing us with healthcare services. One year you journaled, there was in your journal where you actually saved Dr. Counts and I, our brother's lives, by him going into that van, and his A1C was so high that they took him immediately to the clinic up in Hill City, and they did. They saved his life. And you guys are no longer providing those services. I see the pillars and you're doing the data and the research, but when will, or if we can, get that service to these rural communities and during our celebrations where there are so many African Americans that are present? And I am going to close my camera.
Thank you for that question. And I think in a nutshell, what you're saying is, how can we ensure that we're providing services not only to our highest populated counties, Sedgwick and Wyandotte, but how can we ensure that those same services and support would be provided for our rural counties? And the answer to that question is
yes.
We definitely intend to provide support for our rural counties. We haven't, we're still working on what that looks like, and that's where those partnerships come in. So I know the earlier question was, how can we partner? That is a way that we can partner, because again, we don't want to duplicate services, but we want to be able to add to some of the great work that our grassroots organizations are continuing to do. And what that support looks like, if it's funding, if it's providing collateral or capital, or the infrastructures that are sometimes missing in some of these smaller organizations. That is the uplift and the support that the center would like to do. And we definitely plan to help support our rural counties. I hope that answered your question.
Thank you. Shelley, I believe I see your hand up.
Yes, thank you. I was just curious, are you working with any of the medical societies in Kansas, like the Kansas Medical Society or Sedgwick County or the one in KC?
There's been conversations. I believe several of our pillar directors, I personally haven't been working with them all, but that is something that we would like to do. And so if you have any suggestions, and again, us being so new, there's so many things to unturn and so many collaborations to be had. And so if there are organizations or societies that we should be partnering with, please feel free to share those. Like I said, I will make sure that everyone, and maybe I don't know who I should send it to, but all of the information on how to contact the center and email, I'll make sure that gets out to the group, and would love to hear any suggestions that you may have.
Great, thank you.
Absolutely.
And I'll just voice over what Dr. Jimena put in the chat. Nicole, you can send all that information to her if you'd like, and we will get it out with our meeting notes.
Absolutely, thank you.
We have other questions for Nicole?
This is like sort of just a curiosity question. Who has been the most interested in funding? Like when you go to funders?
Absolutely. And I didn't leave, I left out the funding slide, so I apologize about that. But we let me just back up. And so we received, our largest funder is Kansas Health Foundation. We received a large grant for them for $2.14 million exactly. So that was a wonderful, opportunity for the center to do the work that we have set out to do. In addition to the Reach Foundation has given us resources, Health Forward Foundation, and then KU has also put up about $1 million to help, or almost $1 million to help support. So being a new center, we're in a very, very good position to help support our community and do the work. We know that there's still work to do and needed resources, but but we are in a place where we can start doing the work. So Kansas Health Foundation, Reach Foundation, Health Forward Foundation, Health Forward, and then lastly KU also provided us some support. Thank
That's
you
amazing.
for that question. Yes, it is.
Sorry, I'm hogging all the questions, but I have one more.
No, yeah.
Would you say a good chunk of other states have something similar, or is this sort of like, I mean, I know the repair project is super sort of cutting edge, and I was so proud to see that Kansas is part of it. What about a center like this? Does this exist in other states?
So it does actually exist in other states, or a few other states. So there is a Center for African American Health in Denver, and then there's some other centers that are similar. They're not being identified or called the Center for that state. So there is one in Denver. There's also one that is doing similar work in Chicago, and then another in Texas. But for this, but we by far are it's in Denver, and then it's in the state of Kansas. So we're really proud and really know that we have, not only work cut out for us, but really want to be a forefront leader in the work moving forward.
That's wonderful. It's always so nice when Kansas is ahead,
Right. Unfortunately, we're behind on the outcomes, but
Well,
that's where we hope to make that change and impact. But no, I understand your point, Dr. Garcia.
That's 100%. When I feel like work gets hard, I feel like we have so much work to do, and so yay! I'm just so grateful to hear about what all you're doing. Well, I'll take one more sec to see if anybody else has any questions. I don't want to miss anybody. Okay, I guess not. Thank you so much, Nicole.
Thank you.
I wanted to take a second to open the floor to see if anybody has any announcements about upcoming events or anything they want to share.
Hi, this is Marixandra Alvarez. We're having a September 30th event here at Hispanic Heritage Month in Wichita. And the Mexican consulate was going to be here for the grito. And we will be also presenting the first Mexican Braille flag. So if anybody has any plans, or they want to make plans to come here and be at this event, this is a great opportunity not only to be part of one of the only unique events that's going to happen on September 30th. It'll be at the Nomar Plaza, 21st and Broadway.
Thank you for sharing that. Anybody else?
Good afternoon. Good
Go
afternoon, Dr. Garcia. This is Dr. Tammy Counts with Family Counts and Consultants, LLC. We have received a grant, a PAVE 23 grant. So we will start our project October the 4th. We'll be back at Willa Gill Center and Village Initiative, vaccinating, testing, providing other health awareness. We're going to be talking about our food insecurities that we have here in Kansas City, working with harvesters to pass out extra food boxes to those who are without homes and those who are underserved. So we are back, we are up and we're ready, and we will have a calendar out in which we will be at the same locations on Wednesdays and Saturdays to serve our community. And our strike team is the Kansas Black Farmers Association.
Thank you for that. Kansas Black Farmers, you guys have really been with marching along for the whole time. I'm so amazed with all the work that you're doing. You persist. It's amazing.
Dr. Garcia,
Go ahead, Peggy. Sorry. Yeah.
Okay, all right. Well, I thought, well, okay, I might as well jump in here. And so I'm Peggy Fox, President and CEO of the Wichita Black Nurses. And I would just like to share with everyone that we are having a fundraiser October the 7th at the Wichita Marriott for nursing scholarships. As we're all aware, there is a significant nursing shortage, and we want to be able to encourage the nursing students that are there to stay in class and to complete their program so that we can help facilitate a pipeline of nurses for the future. So that's going to be October the 7th at the Wichita Marriott. Doors open at 5 and we'll go till 11 or 11:59. Just wanted to make you all aware of that. If you would like to get involved and attend that, you can purchase tickets online at www.wichita blacknursesassociation.org. It's www.wichitabna.org. Thanks.
Thank you for sharing that. I am planning to attend, so I'm pretty excited to be there.
Well, you're doing more than attending. She's a speaker, y'all. Thank you, Dr. Garcia, for that.
Thank you. I just wanted to give Michelle a moment if you do want to talk about the event that you posted.
Yeah, I was driving when I posted, well, kind of driving when I posted it. But now I'm settled. October 20th and 21st, we are having an art and film fest, as well as a sister to sister tea. So it's a weekend about survivorship. And so we're letting people give their survivor stories. So whether it's breast cancer, whether it's COVID, whether it's domestic violence, because we know that breast cancer and domestic violence month is October. And so, but we're extending those survivor stories. And so we're allowing women from every walk of life to be able to share their survivor stories in whatever art medium they choose to do that. And on Friday night, we will come in and we will see the top 3, and everyone that is there will be able to vote on those to be able to choose the final grand prize winner. And then on Saturday, we will have a sister to sister tea, and we will share and have some people share their stories, and we will share information. We will share COVID information as well as breast cancer information. And it'll be a beautiful tea for ladies to be able to come out. Each woman will walk away with their own personalized teacup and saucer, and it'll just be a beautiful weekend. And you can go to sisterscanwetalk.com online to get more information.
That looks so amazing. Okay, well, if there are no more announcements, we look at that. We're done 8 minutes early. I feel like I owe you guys a lot of minutes because we always just like talk right up to 1 o'clock. So I'm glad we have a few minutes to give back. And please join us next month, 3rd Thursday of the month, same time. And thank you, everybody,